Hey everyone, so I'm here today to answer the question of the week, and the question of the week comes from Scott Tate on Facebook. And Scott asks, is there evidence of negative interactions with cannabis and SSRIs? So if you don't know what SSRIs are, they are selective serotonin reuptake inhibitors. They're commonly described antidepressants, and they're also used for anxiety and for a variety of different mental health disorders. So this is a really good question, and I wanted to answer it because I do know that there's a lot of people who are seeking cannabis for mental health disorders, and they may have tried SSRIs in the past, or they may actually be currently on SSRIs. So that's the reason why I really want to answer this question. Unfortunately though, we don't have any randomized controlled trials saying what happens when you add cannabis to an SSRI treatment. So at that point, I really can't answer that question based upon randomized controlled trials. I can just answer based upon my own interactions and experience that I've had with my patients. But in general, with my patients and with cannabis and SSRIs, I haven't found too many negative interactions. When patients have been using SSRIs and when they've added cannabis to the regimen, they haven't really noticed anything negative. But it's really difficult to say if this is always going to be the case, because you could add it and you could have a negative reaction. So, unfortunately, the bottom line, the answer is that you really should discuss this with your family physician, and you should make a plan about it together. Because if you are getting better by using both, then of course, using both would be good for you. But, if you are getting negative side effects, and that's something that you want to discuss with your physician, because at that point, if you just initiated cannabis, you're not really sure if the side effect is coming just from the cannabis alone, or maybe an interaction between the medication and the cannabis itself. So it is, a thing that, or a question I think that is personalized. It can't, just be answered generally like I'm trying to do on a video right now. I think that the best way to answer this question is to go speak to your physician and to actually have a conversation with him or her. So, sorry if I disappointed you by answering this question in a little bit of a roundabout way, and suggesting that, ultimately the answer is to speak to your physician. But I think that it's a question that needs to be addressed. And I think that if you are someone who is using both cannabis and SSRIs, you should definitely speak to your physician about that. So I really hope that you enjoyed this video, guys. Please comment below, ask any questions that you'd like for me to answer next week, and I'll be back again then.